From afar, you might mistake Katie McLean for someone much older than she is.
For me personally, it's really turned my life upside down.
McLean was a healthy, active 42-year-old with a full-time job in Vancouver when she tested positive for COVID-19. More than a year later, McLean hasn't recovered. She's struggling with long COVID.
Even though I wasn't hospitalized, I got sick and then I just never got better. So I'm that person that is in that group.
That group is people no longer infected with the virus but still suffering. Researchers have found long COVID is associated with more than 200 symptoms across 10 organ systems, including the brain, heart, lungs, and blood vessels. Long COVID patients have at least one unexplained symptom lasting longer than 12 weeks.
I hope that there is going to be recovery in the future, but it's hard to know what that will be like.
There's no known cure, and doctors are now operating without a treatment playbook. But armed with health questionnaires, blood tests, and lessons learned from other illnesses, they're trying to write one. At the same time, they're trying to help people like McLean. She's currently a patient at St. Paul's Hospital, which is part of a new post-COVID clinical care network overseeing 2,600 long-haul patients.
Those tests are administered on a regular basis at regular intervals for patients so that we can then look at patterns and clusters and help to learn that way.
Dr. Adira Levin runs that network in BC. It's early days, but Levin says what's clear is patients can't go from doctor to doctor looking for help. They need a trusted space where experts come to them.
Just the notion that there is this place where people who are experts or becoming experts in this area are watching you and reviewing your case on a regular basis, that support and that listening and validating is also very helpful to patients.
Hey everyone. Hey. How you doing, Derek? It's so nice to see you.
At the Toronto Rehabilitation Institute, they're on the exact same track. It's another one of the roughly 20 long COVID clinics across the country.
The fatigue doesn't really have a really set pattern like some of the other things do.
Derek Christie is meeting with 3 medical specialists for a range of symptoms.
So what are your primary goals for your program here?
Well, I'm hoping to overcome this pain that I have.
Despite taking precautions, Christie, a musician, caught COVID back in April. The virus wrecked his lungs and nearly killed him. His partner was asked to say goodbye to him twice. Now he's embracing his recovery.
I'm pretty motivated because I looked at this as a big opportunity and I wasn't going to squander it.
But it's all trial and
I
error.
think we were just so nervous because no one had any idea.
Dr. Alexandra Rendelli says no 2 long COVID patients are alike.
We see a yo-yo of symptoms, so to speak. So they'll say this is kind of how it started and then it moved to this.
A large Canadian survey found the top reported long COVID symptoms included fatigue, shortness of breath, brain fog, muscle and joint pain, and the list goes on.
We're really able to take evidence-based information that's been studied from other populations with similar symptoms, but from a different virus or from a different pathology, stroke, MS, spinal cord injury, and take that research and bring it to our COVID rehab patients.
Like McLean, Christie desperately wants to walk independently again. They're both following advice from physiotherapists, including strengthening, pacing, and heart rate monitoring.
Are you comfortable in that chair?
Christie is venturing into the clinic for his next appointment.
Hey, well, it's nice to see you in person again. It's been a while. Nice to see you too.
He's not sleeping and still experiencing shooting pains. Christie's struggling, but he knows his doctor is listening and still learning.
No matter what you've done.
Before COVID, he was playing live music on stage, and he's determined to go back.
You have to rebuild your body, and for me, it's going to take probably 6 to 8 months just to be able to walk normally.
And he's not alone. It's estimated at least 10% of infected adults will have long COVID. That's roughly 170,000 Canadians. But doctors say if this team model of care can effectively treat this wave of long COVID patients, it could transform patient care for other conditions as well.
I think this is the beginning of perhaps a change in the way that we look at healthcare and how best to integrate research and care in the moment.
But already, wait lists for long COVID services are growing, and not all treatments are covered.
I really wish that all Canadians had access to centralized care for long COVID, because it's quite a terrifying thing to go through, and I've never experienced anything like it in my life.
Last night was the first time I actually picked it up and strummed in about 6 months.
Christy's recovery may be slow, but new treatments are on the way, and many hope one will lead to a cure. Christine Birak, CBC News, Richmond Hill, Ontario.